This week's benefit breakdown is going to be covering what I would consider to be the most important aspect slash component of your medical plan that your employer offers you. Today, we're going to quickly just go over what is the out-of-pocket maximum. So the out-of-pocket maximum is supposed to be your true total exposure as far as claims in any given calendar year or a plan year if you have a plan year out-of-pocket maximum. So a lot of people get confused on what counts towards the out-of-pocket maximum or how it gets calculated, but essentially your deductibles are going to count towards that out-of-pocket maximum. Your copays will count towards that out-of-pocket maximum, and all of your co-insurance would count towards that out-of-pocket maximum. So the simplest way to think about it is every dollar that you spend, whether it's prescriptions, office visits, major medical claims, every dollar you spend throughout the year on a covered medical claim will get credited towards that out-of-pocket maximum. And the point is, eventually, when you hit that out-of-pocket maximum, all remaining claims or future claims from that point would be covered at 100% by the insurance company. So you would pay no additional funds for the remainder of that calendar year once you hit that number. So one thing I did also want to touch on is the Affordable Care Act. When it came about, it really made these out-of-pocket maximums be true out-of-pocket maximums. So some of the positives of that are naturally, this is a true total exposure. So it would give you a peace of mind as far as knowing, hey, even worst case scenario, I'm not going to go over this dollar amount on my medical claims. And also just knowing that all of your spending is being counted towards that dollar amount. But one of the biggest cons to this having a true out-of-pocket maximum is when they created these back in 2014, they started around $6,000, I believe, was the maximum out-of-pocket. But they allowed those to be indexed on an annual basis. And presently, we're dealing with $8,700 out-of-pocket maximums. So why I think it's a really big negative is $8,700 is a lot. It's a lot of money that someone could possibly spend on their medical claims. And we're seeing these $8,700 maximums be on gold level plans, which, you hear the word gold, you think traditionally that's going to be a really rich plan. But is it really rich if you still have to spend $8,700 on claims throughout the year? Because, most people are going to have a really hard time coming up with that dollar amount. The other big con to having it be a capped and indexed is it really prevents the insurance companies from having plan flexibility, which also prevents them from having flexibility in premiums. So what we're seeing is most companies are defaulting to whatever that annual maximum is that the government allows each year. So, you might have 20 plans, but if they all have, the same or similar out-of-pocket maximums, to me, they're all very similar. And the insurance company also shares pretty much the same risk regardless of which plan you choose, which means that they're going to want to collect similar amounts of premium for those plans as well. So I think it really just makes it, more difficult for both sides, the employee, if they have major claims, but also for the insurance company to be able to even price themselves competitively. So that's all I had to say about the out-of-pocket maximums this week. I hope you learned something. As always, thanks for tuning in, and we'll see you next week.